this is Linda. Linda came to see us maybe a little more than 6 months ago,
Yes,
and now we have you on a maintenance program. Is that correct?
yes.
You know, it's kind of almost hard to remember somebody who was just going through it before we started the video.
Kind of forgot how I used to eat.
Yeah, it's hard to remember what someone came in from once they're on maintenance and they're feeling good and we're just staying
It's
healthy. So, congratulations for that we're having trouble even remembering what brought you in the office.
Right.
But as we look at your notes, what we can see is that some of the major problems you had when you came in, one, medically they weren't sure what was going on. Maybe they thought scleroderma. You had some lung issues, some breathing issues. You had vertigo issues, weight issues, and you had a lot of digestive issues, particularly with heartburn.
Yes.
So, why don't you tell the audience a little bit about your experience here?
I guess just that I had pretty much given up. As you say, I've been to quite a few specialists and pretty much coming up with nothing. I was pretty much living on Tums, and I think that's what promoted me to. I just was not feeling well every day.
Yeah.
And I was skeptical, quite honestly, because I
Okay.
just couldn't believe that something would, that your diet could make that big of a difference. So I was pretty amazed after the 3-month trial period where I had the blood done in you. Plus, I think it was the first time I had gotten answers or maybe hope that there was some kind of logic behind everything, because I just kept getting this, like we don't know.
Yeah, I mean, the difference here, Linda, is that, when we go to our medical doctor, often we're given a diagnosis and then we're given the appropriate medication for that diagnosis, but we never get the question answered of why do I have this? Why doesn't my girlfriend have it, my sister, my husband, so forth and so on. So we take the medications for the effects that we're demonstrating, or the symptoms that we're demonstrating, but they don't necessarily get us back to health.
No.
And that's really the problem. So our goal was to take blood work on you, figure out what systems in your body weren't working well, look at your x-rays, see how you're doing upper cervically, which is always important to us, and then try and improve all the metabolic and neurologic systems in your body so you can be healthy. And I think we've done a nice job with that. And, frankly, a lot of it has to do with you, because you were a very compliant patient. So you made our job easier.
Well, I think when you start to lose hope that something will change and that you really don't feel well, just that little bit of encouragement or hope, actually, it was the first time I had gotten an answer that I thought, maybe I can do something to change that.
Well, that's the whole point of the testimonial, so the patients could see.
When I saw the results, it was like just very motivating.
Right.
I don't think I'll ever go back to how it was. I really feel like it becomes a life change.
It was funny, I was watching the Biggest Loser last night, and they were talking about how so many of these people on the show, the competitors, the contestants, how they've lost weight before and always gained it back, as they go right back to that lifestyle. And I think a lot of it is because they're not being educated properly, so they don't know exactly how to stay on the right path.
And I don't think that they realize. I don't think they realize exactly what the metabolism is doing, or why.
Right, exactly.
So I think once you understand that and then you see the results of it, I think it's very motivating. I don't think you want to go back. I mean, even, not that I've never cheated, but I don't feel well when I do.
Right, your body
and I
lets you
think
know.
that's the best lesson. I think that's
the problem for someone out there who's listening to this, who's not feeling well. When you're putting things in your body that aren't good for you because you already don't feel well, you may not even be able to tell. With our patients, once they start to feel better, then they put something in their body that's not good for them. They know right away because they're feeling good, so you could feel the difference.
It's your own, right. That's what I said. I mean, now I don't even have a desire to have any of that stuff because I'm not going to go do that.
Absolutely. So we did this blood work in the beginning, and we found all this stuff on you. And then the program in our office, folks, is that we put a patient on chiropractic care right away, mostly upper cervical work. And then we put them on a nutritional program, and we start healing the parts of their bodies that aren't working well through supplementation. Usually after about 2.5 to 3 months, we could redo blood, which is what we did with Linda. Do you recall what happened when we redid your blood?
Oh, it was amazing. It was just amazing. I mean, my cholesterol dropped in half. I mean, I couldn't even believe the figures. I thought that they couldn't be real.
Yeah, I'm looking.
But I also
your cholesterol went from
felt
252 to 166.
Is that crazy?
And your triglycerides went from 207 to 68 in just 1 month. And what's crazy, in 3 months, excuse me, what's crazy about that is most doctors will tell you that's impossible. And we get that all the time.
I wouldn't have thought it was possible. I wouldn't have thought I could feel that well. I mean, I remember thinking after I was on the program, and I mean like 4 days. just on the program. And I remember thinking, all right, well, I haven't needed any Tums, but that's probably just a coincidence because of, you know.
Sure.
And I haven't taken any since. I mean, that to me is crazy. I was living on them. I was like eating them every day. So for me, that was just like the
That's awesome.
best. And I still feel better. And the weight loss, it's slow. You just very slowly start to feel better, start to feel more active.
Yeah. How much weight did you lose overall?
30 pounds.
30 pounds, that's great.
Yeah.
That's great.
Yeah.
That's fantastic.
And I think it'll be I'm not where I want to be yet, but I think it'll just keep going because I don't mind it. Like in the beginning, I remember when you gave me the diet, and I thought, what can I eat? What am I going to eat? And now it's just second nature.
It's just second nature.
Right.
I think what happens
I would
is
never believe
people
it.
come into us, and most of the time they're fairly just desperate. So
Exactly.
they do what we tell them because they're
Exactly.
desperate, but then when they start feeling better, it's
Yes.
the encouragement you need to say, wow, this is working,
Right.
and I can do it, and I
Yeah.
will be better, and I just have to do
And
what these
things
doctors
that I
tell
didn't
me.
think I would enjoy, I now enjoy.
Yeah.
It now just becomes, what it is. And I really like the feeling of never being that full or that stuffed
Right.
or.
And for you, because
Immobile.
you had that problem, a lot of your problems became inflammation.
Yeah.
Because when we have dietary or digestive concerns, it creates inflammation in the body, which is just painful, fatiguing, uncomfortable. You don't like the way you look. You don't like the way you feel.
Yeah.
Are you having any more of that? Or that's all gone.
All gone.
All gone.
Not just that, I have a pulmonologist ever since which I had been sick before I came to you 5 years. And my most recent appointment with him was, the test results were the best they've been
That's awesome.
after 5 years. So I feel like it's motivating. I mean, it really is.
Sure. So what would you say to someone who was watching this video?
That you can't replace hope in your life.
It's true.
There's nothing more important.
The body heals. And it can heal from anything.
It does.
But you have to, and only you heal though when it's working right. And that's our job. We don't treat any condition. We get your body to work right, and then regardless of what the abnormality is, we can get better because that's the job of the body.
I was afraid to hope in the beginning. I really was.
Yeah.
But it's been great.
I'm happy for you, and thank you.
Thank you. Thank you.